Hello everyone. This video I will talk about how did Thailand flatten the curve of COVID-19. Thailand reported the first case of COVID-19 on 13 January 2020. Cases were few initially, but by mid-March, the situation started to escalate. Rapid Asia has followed how the disease had developed over time and how Thailand has managed to flatten the curve over a relatively short time. When tracking COVID-19, the focus was to look at two key indicators: the number of new cases and the number of active cases. See Figure 1. When following this data, it was noticed that new cases tend to peak at certain times during the week. To highlight the actual trend, a 7-day moving average was used. That is, each data point in the chart showed the average number of cases over the past 7 days. Net active cases represent the number of people still in hospital care, and this gives us an idea of how the virus is impacting on the health system in Thailand, which at the peak of the epidemic in early April was coping with an additional 1,500 patients, many of whom need specialist respiratory care. The chart highlights several key events that occurred between 1st March and 3rd May and shows how incidence and prevalence change as a result. Over the first 10 days of March, there was just one new COVID-19 case per day on average. On 11 March, new cases began to approximately double every 2 days until the prevalence of new cases peaked on 22 March. In response to this, many business and public venues were ordered to close. Note that the curve started to flatten almost immediately, but the average number of daily cases continued to increase to over 100. On 26 March, Prime Minister Phudit declared a state of emergency. At this time, some people start to leave Bangkok and spread the virus to other provinces. From 30 March, the prevalence curve showed renewed but smaller build-up in average number of new cases. On 3rd April, the Thai government announced a curfew and imposed a range of measures to deter social gatherings, including banning the sale of alcohol. Active cases continued to increase, but after 1 week, prevalence also started to decline. This is consistent with the World Health Organization advice that the average incubation period for the virus is about 5 to 6 days. As the number of new cases continue to taper off, the number of patients in hospitals continue to decline as well. By 13 April, active cases represent less than 50% of all cases. From that point on, there has been a steady decline in both incidence and prevalence, save for a minor spike on 25 April when a cluster of new cases were discovered at a detention center in Songkhla. As of 3rd May, the daily average was down to 7 cases. At this time, record deaths stood at 54, less than 1 person per 1 million. Based on this figure, it appears that Thailand had managed the virus better than 140 other countries. On 4th May, Thailand started to lift some restrictions, while the curfew and alcohol ban will continue. Select business establishments will open their doors. A potential resurgence in the spread of the virus is of course possible as a result of this policy. However, a major difference between the situation now and in early March is that people are more conscious about the risks and are taking protective measures. Example, wearing masks, regular hand washing. Also, the Thai healthcare system is now better prepared than before the outbreak and has a greater capacity to respond. For example, with more ICU beds, we can only hope for the best, and Thailand will be back on its feet sooner rather than later. If you found this video useful, please remember to like, share, and subscribe to never miss my video. Thank you.